नहमदुहु व नसल्ली अला रसूलिहिल करीम। अस्सलामु अलैकुम व रहमतुल्लाहि व बरकातुहू। Alhamdulillah, I'm again thankful to MessageTV.net for giving me the opportunity to say something about hijama, this time in English inshallah, because I've had a few requests from Europe and America that if we discuss about hijama in English, it may benefit some more people inshallah. So inshallah, alhamdulillah, jazakallah khair for MessageTV again. I am Dr. Iftikhar Ahmed Saifi. I am American board certified naturopathic medicine doctor, and I also graduated from India in Unani medicine and surgery from Aligarh Muslim University. And alhamdulillah, hijama is a big ni'mah, big blessing from Allah subhanahu wa ta'ala given to humankind. What is hijama? Hijama is hajam in Arabic means suction, to create suction. And there are so many, if you just Google about hijama, you will see synonyms of hijama like cupping therapy, etc., etc. And many times we misunderstand that, because cupping therapy is the closest term that we can use in English to define what hijama is. However, in Chinese cupping therapy simply means you just put the cups, create negative pressure, and that's it. When we talk about hijama is basically you make little pricks, you make little incision, and then you extract little blood from that. Of course, you use the cups. That's why we can also call it cupping therapy, but rather better to call it wet cupping therapy, or call it hijama. So hijama is a sunnah treatment from Rasulullah sallallahu alaihi wasallam. However, it is not that Prophet Muhammad sallallahu alaihi wasallam he invented that or he talked the first time about hijama. Hijama has been there in the trends since ever. And if you go back to one of the oldest medical documents found from Egypt called Eber's Papyrus, written in 1550 BC, there's a good mention of hijama in there also. Also, the Hippocratic medicine, the Greek medicine, or so-called Unani system of medicine, now the modified version of that, there's a good mention of that. So Bokrat or Hippocrates talked too much about hijama, and Galen or Jalinus, he was a big fan of hijama. As a matter of fact, in some of the documents, we see that he criticized one of his contemporary physician for not doing hijama in his practice. So he was a fan of hijama, he liked hijama, he saw the benefits of hijama. And then afterwards we see Ibn Nafees did hijama, and Ibn Sina was a big fan of hijama. In his book Qanun fi Tib, or Canon of Medicine, which was the textbook of in medical schools in Europe close to just 150 years back, and he described in detail about hijama. And then Razi, Hakim Abu Bakr Zakaria Razi, he talked so much about the points of hijama and emphasized on the days of hijama as well. So there's a good book to read by Professor Ghazala Al-Mulla from India, Pune, and she has made a good mention of these, even the points from Razi's and Ibn Sina in her book. So now for Muslim, it becomes more important because Rasulullah sallallahu alaihi wasallam did that. We know that anything that Rasulullah sallallahu alaihi wasallam said or asked to do, it is important for us. And if he did something, hijama is so important because it is not that he asked us to do it, he got it hijama done for himself also, and he was told by angels to do it, and he was told by angels for him to do it. He was asked by angels that you ask the ummah to do it. So there are so many strong hadiths about that. So you can just Google, there are so many hadiths. I'm just giving little references of that, and inshallah just read yourself. That he said in one of the narrations, close to the meaning, that whatever treatment methods you adopt, hijama is best of that. And then he said there is shifa in three things. There is shifa in the cuts of hijama, there is shifa in the gulp of honey, and there is shifa in the cauterization, but I discourage cauterization. So And even the days of hijama, the best days, he mentioned about that. He did himself on hijama a number of times. He had headache and he did on the top of the head, and he got injured, he did on his foot, and he did otherwise also. He was poisoned, he did hijama on the al-kahil area on the back, the upper back. So for different purposes, different times he did hijama. He did hijama when he was fasting. He did hijama when he was in ihram. So it was something that he did to treat himself. So really, now for us, I mean, sometimes we may think that is it like farz for Muslim to do it? So many times, I don't want to answer that because this is not my domain. Ulama will answer that question rather. But I asked ulama, they said why not to do it? Because I mean, do it for health. I mean, do it for health because Rasulullah Sallallahu Alaihi Wasallam said there is shifa in it. Indeed there is a cure in hijama. One of the sayings of Rasulullah Sallallahu Alaihi Wasallam. All are sahih hadiths. There are so many hadiths about it. So I think this is one of the strongest things that we can do when it comes to healing and health and wellness. Why not to take advantage of hijama? It's one of the best things. I feel that hijama is one of the best gifts you can give your body. And alhamdulillah, I have done few thousand hijama. I don't know exactly how much, more than 5,000, maybe 6,000. I have no idea. But alhamdulillah, I see every time people are smiling. It helps them a lot. In many chronic conditions, I don't have time because I just want to make it as brief as possible. People really get help with hijama. Of course, you just do a little bit of changes in lifestyle and few things, and it's like a complete set. And even if we see the life of Rasulullah Sallallahu Alaihi Wasallam, many times, this is one of the questions people say, or may have this question in mind that, okay, I'm doing hijama and still I'm having this issue. See, hijama helps. It helps. However, it doesn't set a guarantee for what you do in your life. I mean, you have to take care of the causes, you have to improve the lifestyle. If there's some damage on the sofa furniture and you call the upholstery guy, he gives you guarantee to fix that. But if you don't turn off the tap, still water is flowing down from that and it's damaging the furniture. The upholstery guy cannot give guarantee for that. So you have to see what you're doing in life. Take care of those things also. And even from Rasulullah Sallallahu Alaihi Wasallam's life, we see that he talked about hijama. He got hijama done, but he talked about many other things also. He was a person who would fast a lot. So fasting is good for your health. And he would be very picky in food. He was very selective in eating, and he would eat less. And he was take a lot of care about other things also. So if we just take his life, better take as a complete package, and then inshallah we are well from it. But again, hijama is one of the best things you can do. Now from medical point of view, little we know about that. Still it is like the researches on hijama is in infancy state. But what we know is already quite strong enough that will make us to do hijama. So, and all the time I believe that there's so much hidden in hijama. It is beyond the pathophysiological pathways that we can understand about hijama. So inshallah, many things we understand, many things we don't understand just because it is the saying of Rasulullah. Inshallah we do that, inshallah we benefit from it, and also we benefit from health, and also we please Allah and we revive one of the Sunnah of Rasulullah. So from medical point of view, we understand. So everyone these days talks about donation of blood. All the doctors, they say, okay, donate blood. Particularly cardiologists, they say donate blood because it is good for coronary artery condition or heart diseases. Why? Because one of the risk factors for heart disease is iron overloading, for example, because iron oxidizes, and when it oxidizes, it oxidizes the cholesterol also. It makes more LDL, the bad cholesterol. So it is one of the things. There's a Dr. Philip D. Christopher. He's the director of the Loyola University's blood bank system. He says, people have too much viscosity in the blood, and he gives an example. He says that it's like blood is like molasses. It flows like molasses, like it's very sticky. And this stickiness or high viscosity of the blood causes a lot of damage in the arteries and causes a lot of plaques also in the arteries. So he said it's really a good idea to go and donate, and he encourages us that we should be a regular donor actually. And there are so many studies about that. And there's one American Journal of Epidemiology. They have found out through the meta-analysis, pooling of many studies, that the regular donors, they have 88%, they are less likely to develop arterial condition like heart condition, coronary artery diseases, and they say less likely to have strokes and even cancers. So it's one of the best things you can do. Now it is even there's a study, actually a couple of studies about that premenstrual the menstruating ladies, they have lesser chances of having heart conditions than their postmenopausal ladies. So once they go into the menopause, they stop the menstruation cycle, they have higher risk of coronary artery condition in comparison to men actually. So this gives a good example, because they are menstruating, so there is a recycling of the blood. So men do not menstruate, so there is a really good alternative for men, that they can have hijama done. Now sometimes we can think, since women are menstruating, do they need hijama or they don't need hijama? Well, hijama, like extraction of blood, is just one of the many factors how hijama helps. So still there are so many other factors, for example, the pricks we make, they cause a lot of secretions of many positive hormones. So still, it's good, even if they are menstruating, they can do hijama, inshallah. But of course, they don't need so much of hijama pricks like men do in comparison. So it's a good idea for them also to get it done. Now, how hijama is, so this is one of the best, one of the things that when we donate blood, we feel better health-wise. Now, for example, iron overloading is a big cause of a lot of health issues these days. For example, cirrhosis of liver cancers even, dyslipidemia, high cholesterol, the conversion as I mentioned, and also Alzheimer's is one of them. Even type 1 diabetes is one of them. So we are a regular practitioner, we are doing hijama regularly, so we'll feel better. Now this is, the studies is just about the donation of blood. How about hijama blood? Hijama blood is a little different from simple donation, because hijama, when we make pricks, we extract the blood out from the interstitial tissue spaces. So this blood is not just a fresh blood, because when we donate, this blood is from systemic circulation, and it's a comparatively fresher blood. But hijama blood is has a lot of debris and unwanted things with that. So it's toxicity and lactic acid and lymphatic fluid, so many things. So it is really, so if you do hijama, it is even much better than simple donation. The other is just the pricks. So when we make pricks, it causes a little injury in the local area. So this injury, there are so many studies done on that when it's like hijama is a planned, sterile and controlled injury made to the skin. So as a response, it's like it causes physical disruption of keratinocytes in the epidermis, and this as a result causes activation of innate immune system. We have two kind of immune system, innate and acquired. So innate immune system gets activated, and as a response, it causes secretion of a lot of AMPs or antimicrobial polypeptides, and then they take care of the local issues, if it is debris, if it is the worn out cells, or whatever the toxic waste, etc., etc. So it's good. And then other is, it has some inflammatory responses. When we make pricks, it's like an inflammation on subclinical level. So inflammation is a defensive mechanism of the body. When there's inflammation, it means body is trying to heal itself. As a sign, there's a redness and there's a heat, there's a little swelling, and there's erratic movements and pain. So these are all signs. Why? Because blood rushes towards that area, because blood wants to take care of the situation, whatever is going. It's like a high risk situation. So during this phase of inflammation, what happens, there's a lot of influx of neutrophils, and neutrophils, as we know, they do phagocytosis, which means they engulf the bad bacteria or pathogenic microorganism or toxic waste or debris or worn out cell, so whatever. And so they do all the healing as a response to inflammation. The other is, there's monocytes in the same blood. Monocyte, they go through a series of changes. They convert into macrophages, and macrophages, like, they become like also phagocytotic properties. They already have that, it's like they start engulfing that. So now they become when they engulf the bacteria, the macrophages, they become antigen, and when they become antigen, they cause in creation as a response of many antibodies. So antibody, antigen, things start going. So this is how they activate the immune system now. So many other factors how it helps. And then the secretion of many, when we make bricks, as I mentioned in the beginning, Hijama, the extraction of blood is just one of the factors how Hijama helps. It's multifactorial. When we make bricks, as a response to this bricks, a lot of positive secretion take place. For example, endorphin and caffeine. These are so beautiful hormones that they secrete in the body, which causes relaxation of body. They are mood lifters, and dopamine and serotonin hormone, they are secreted, and they are natural painkillers also. And one hormone called interleukin, which balances or modulates the immune system, also gets secreted into it. So it's really awesome. The other is Chinese medicine theory. The acupuncture. Acupuncture is endorsed, approved system of medicine from WHO. Now we know that Hijama pricks are more stronger than acupuncture. So whatever happens as a response to acupuncture needles happens also with the needle of Hijama, but in a more stronger way, in a positive direction. So this happens. And then the local thing, there can be stagnation locally. So there's a pain or muscular spasm or something, or lactic acid stimulation or secretion or accumulation. When we do Hijama, we just extract that out. Now from a Unani system of medicine point of view, there can be a morbid humor. There can be a hurt which is a little aggravated. So you do tanqiyah of that, you do ikhraj of that, just extract that out. So from that point of view, it really works. Unani people who are expert, they know, mashallah, they are good at knowing about the mizaj and health, and what health is aggravated at this point of time. So they work on this accordingly. So it's one of the best things for that. Now there's a spinal theory. We have the whole spine, and we have whole nervous system running through that, and through the foramens of the spine, the ganglionic fibers of the nerves, they supply the whole body. So it's like, from the back, the whole body is taken care of. So when we do at certain points, we trigger many of the corresponding organs attached to that. So, it's like, for example, if we do it just at the base of the skull, this area is responsible to supply through the eyes, through the thyroid, through the brain, so many, so it's really one of the best parts. Now in the upper part, for example, if you do alcoholism, this is good for your thyroid, for your lungs, for your heart, and so many things. So so we sometimes do Hijama based on a spinal theory only. And there's a lymphatics. We have a lymphatic channel, like we have a blood system, we have a lymphatic system also. The role of the blood is to collect nutrients, collect oxygen, collect glucose, and then supply all over the body. But the role of lymphatics is to collect the debris. They collect the unwanted thing from the body, the ammonia derivative, the waste products, worn out cells, even sometimes cancer cells, and then just extract that out. Generally how it does, it collects it from the blood, collects it different interstitial tissue spaces, and then just pours in the intestine, and then we excrete that out. But there's one thing, limitation with lymphatics, that to move blood we have heart that pumps the blood throughout the body, but for lymphatics we do not have any heart. Lymphatics move only if we move. So if we are not physically that active, we may have slowed down lymphatic system. So when we do Hijama, because most of that lies in the back, so when we do Hijama, we extract that lymph fluid also out. So alhamdulillah, there are so many ways, still we are learning more about Hijama, mashallah. So what we already know is quite strong, and that's why these days, mashallah, you see that people are doing Hijama. Even a lot of sports people are doing Hijama, and it's like in many hospitals in Germany, in America, they have started doing Hijama. But alhamdulillah, we do it because of Rasulullah said it. So inshallah we'll continue doing that, and we will benefit from the science also. Why not? So, but now one thing, sometimes people think if I'm doing Hijama, then I will just quit all my medication. No, it is never advisable to do that. Just keep in touch with your doctor, and he will advise you best. Anyway, even Rasulullah, he did that, and he still advised take Habbatul Baraka, take kalonji seeds like it's medicine. He says take honey, and do many other things, and take ajwa, for example. Why not do that all, inshallah? So now Now, so many people are doing hijama, and I just my suggestion to them, then inshallah do it in a nicer way, in a cleaner way, and I'll just give you a tip inshallah. So how to do that? This is a set of hijama. I want you to copy and paste what I'm doing here, and you can improve that. I'm not the final version of hijama. You can always improve that inshallah. So keep everything clean, nice and clean. We have autoclave machine, mashallah. All these things actually, this you're seeing, this is like a one sheet. Everything is wrapped up here, and then we autoclave that, and we sterilize it. Everything that you see is like you pack that here, and then use the gloves, for example. And with the gloves, I will touch it now, but otherwise I'm not even touching these things without the gloves. But I'll just show you because I'm not doing any hijama right now. So you have all these things here, mashallah, for betadine, scissors, a scalpel holder. Even the cotton is autoclaved, sterilized, and we have these gauze packs. So instead of a tissue paper, better to use this cotton gauze pack. Now, in my previous video that I made in Urdu, there's some questions about that, because in the footage there's the person who is doing hijama is shown that he's using blade instead of a scalpel. So many people wrote, why you are using blade, So first of all, that video is not mine. So that is from one of my students, mashallah. He's doing a good job, mashallah. But I think why he chose it, I don't know, no idea. But I use a scalpel, and I use this surgical scalpel number 11. It's a really good thing, and in my practice. However, it is not against the law of hijama that you cannot use blade. You can. Most of the blade, try to get a good blade. Most of the blades, they are already sterile. If they were not, you are not, actually you are not supposed to use it on your skin, because you're using it to shave that. So that's okay, but it's a good idea to use the medical scalpel, and I want all the safety and precaution and hygiene for hijama, but it is better not to make it too difficult for some people who are living in remote areas that they cannot do it, because this is a Sunnah Rasul Sallallahu Alaihi Wasallam. Let people benefit from it, but yes, take utmost care that you have to do. I'm not saying take it easy though, I'm just saying about the blade right now. So yeah, these are the cups. So there are some precautions of hijama. So now, before that, I would just walk you over through, like if someone comes to you and how to start hijama. Patient comes to you, take history, better to know more about hijama. And by the way, it is a responsibility for the people who are already in the medical field, who are already doctors. Take this system, do this, because you would do it in a better way. So if you would do it, people don't have to go to the people who are not doing it properly. So my focus and attention and request is to those people who are mashallah doctors, do it. So you can understand more about patient, ask them, take them the full history. History tells a lot of things, not about the precautions of hijama, contraindications of hijama, and then you will see even that what you need to do, for him. So sometimes people are on some medication. For example, I'll just tell you something now here, because many times it is about, for example, if a person is taking some medication, for example aspirin, Coumadin, Plavix, blood thinners, etc., then in the book it is written that you have to ask the person to stop that like few days before, and then you can do hijama, simply because it's hard for the person to stop bleeding when you make hijama pricks. Well, that's fine, but honestly speaking, in my practice, what I have seen, that I have stopped asking these things, because I feel it is not a good idea to stop people's medication if the doctors they have suggested, because if they are taking blood thinners, there's a reason behind that why they are taking it. So it is better not to interfere in that system, and also but you take precaution when you are doing hijama. Make the smallest possible pricks, so everything in control. And generally I suggest and recommend, and I do make smaller pricks. I tried this, unless in some cases that I don't see any blood coming out, then I go a little overboard. But generally I try to limit my cuts to a very small version. I may make little more, because some people make lesser cuts, but they make bigger cuts. In this case, things are out of control sometimes, but smaller pricks, and then you just put the cup, and then comes, you can have 2 sections if you want, 3, but things are in control. So in this case, it's better idea not to ask them. And even then, if you ask, for example, if a person is taking some blood thinners or aspirin, then its effect actually lasts from 3 to 7 days. How many days would you stop this medication? So it's not really a good idea. Now, third thing I would tell you, in my experience, what I've seen, most of the people who are taking these medications, already their blood is viscous and thick. So in most of my cases, I've seen that there's no problem actually. But from the beginning, you make smaller cuts. And I'll give you a tip, practical tip how to start. Sometimes, for example, you find that you have to do hijama on certain areas, and you just figure that out beforehand, that these are the 3 or 5 cups which are more important for this person. Now, before making pricks on these points, make 2 additional pricks. For example, just take stress points on the sides of shoulder, and so this is just to test the bleeding pattern of this person. Make a smaller pricks, go with the smallest version, and then see what is the bleeding. So it will give you an idea that how deeper, how long, bigger cuts you have to make, and how many cuts you need to. So these are not the primary focus of your points, but just you want to know the bleeding pattern of this person. Just a good start. Now, so you just take the history, and then if someone's blood pressure is down, so it is advisable, do not touch the lumbar region, because many times if you just touch the lumbar region, his blood pressure can go down further. It's not a good idea. So, but if someone is hypertensive, high blood pressure, this point is the best point for him. So in most of the, which points do you have to do? You can there are so many theories that you can base your point selection on. The first is, of course, Sunnah, Rasul Sallallahu Alaihi Wasallam. There are some specific points Rasulullah Sallallahu Alaihi Wasallam did. For example, he did on the top of the head, and then he did in Ikhdain. Now, Ikhdain point is a little confusing because many people go here and there, but Ikhdain, the best point is this on the back. This is at the base of the skull. So inshallah, we'll just give you a little photograph, inshallah, and then you will be able to see that, inshallah. So base of the skull. Now some people are hesitant to remove their hair. So just, the second best option is just a little lower, but in the same meridian line. And then the al-kahil points you can do. Al-kahil is an area. It's not just 51, 55 and 1. This is area, but best points is 55 and number 1 for that. And then you can choose other places. Rasulullah also did on feet, and he did on the groins also. So, but again, many times for example, if I have some issues, I'm having a pain here. So it's not necessarily that I do here. Many times people get confused and they say, no, Rasulullah did here and I have to do it. Well, respectfully, he did it. If you can afford to do it here also, please go ahead and do it. But if you feel that too many, you need like few cups and you need the extraction of good amount of blood, then you cannot do multiple points at that time. And this I'm telling you from Sunnah point of view. If you see in Rasulullah where he selected point based upon the need. So he was having headache and he did here. So it's like it was like a indication based selection. So, and then he did, for example, here, hijama, this al-kahil point, he did a number of times. It's always a good idea to repeat that, and I try to just cover this point in almost all my cases. Okay, but again, you can do this point, why not? But what I'm trying to say here is that if, for example, you have problem here, doing hijama at this place is also like you're reviving Sunnah, because he did it according to what he needed at the time also. So now you can select your points based on the spinal theory, as I mentioned, and inshallah you will see some charts, inshallah you will throw. And then also from Unani medicine point of view, as I mentioned, this book, inshallah you can see based upon many humors and mizaj and temperament of people, so you can do that. And also from Chinese acupuncture point of view, you can just refer to some book, and inshallah you can do that accordingly. And the other is, when you move your hand on a person's back, then it really guides you where you need to do. You'll see a lot of stiffness, a lot of lactic acid, and things. And in most cases, if you do hijama on few points on the upper part here, and the lower part, basically you're covering everything. You are just making the blood to loose. You're just breaking the most important areas. Hijama is going to inshallah help you. But inshallah, slowly you will learn. Time teaches many things. There's no shortcut through the experience. So inshallah you will learn. Inshallah, post hijama precautions. After hijama, tell a few things to this person. In most cases, it is a good idea that there shouldn't be any blood coming. I'm not saying just keep on sucking the blood if it doesn't stop. Do this is a healing package, gauze package, and everything. Inshallah, it will stop blood. But in most cases, blood stops. Just clean it nicely. Give him a good feeling, because many times if it's just all dirty and then he goes, he thinks hijama is a big project. Next time he thinks twice do it. Now if you just keep everything clean and nicely, spend 2 minutes extra, clean the back, now he can go like it's his normal regular day. He can go to work, he can do hair. It's not just okay, now you have to go and just no choice but to sleep, and then you didn't clean it properly, there's blood stains coming out. It doesn't give good impression. So clean nicely, and then he can have a little burning going on the back. Just tell him this is normal, that few hours to 1 day even you can have a little burning going on these spots. This is very much normal. Actually, it's a good sign, because like your body is going through the stimulation and activation. Nothing's wrong with that. In most cases, you don't have to put any medication on that, but you are free to do that. You can use any antibiotic cream or antiseptic cream or olive oil or braxseed oil or honey or whatever you want. Nothing's wrong with that. You can do that, but it's not a must. It's not. Now, when it comes to food, you can eat almost anything. Still, I'm trying to find the answer for, some people say don't drink milk and or milk products, and then beef. I understand that fish is not the best thing to take it, simply because it has omega-3, and omega-3 is a blood thinner, so you don't want to ooze the wounds. But otherwise, other thing, I don't know. But still, I like, because you are a hijama therapist, so I'm just talking to you right now. But to common people, I say, okay, why not? Don't use anything from milk and beef today. Nothing's wrong if you just skip it for 1 day. But so this is one thing. And the second thing is to avoid is overeating, because you don't want to rush too much blood towards the digestive area. You want the even distribution after hijama. When we eat food, a lot of blood is required to the heavier we eat, more blood is required towards that area. So inshallah, all these things, I think this time and is clicking, and then we have to do something else right now. So inshallah, all the best. Inshallah, I'll just give you a few links, inshallah, if you want to download, and I'll give you little forms and stuff, how to take queries to your patients, etc. Inshallah, all the best. Assalamu alaikum wa rahmatullah.